Oregonians are voting on a ballot measure that would radically change how the state addresses drug addiction. Measure 110 hopes to fund new addiction treatment and recovery programs and decriminalize non-commercial possession of small amounts of drugs. But as KEZI 9 News reporter Chris Lewinberg shows us, others worry that this system being proposed will let addicts slip through the cracks.
Neither supporters or opponents of Measure 110 deny the growing drug problem in the state, but supporters also take issue with the criminal justice system serving as the pipeline towards treatment. Dr. William Foster, an emergency room physician in Florence, says he regularly sees withdrawal and other symptoms of drug addiction.
Multiple times a month, I have a patient who that is the primary reason they are in the emergency department.
Unfortunately, he says addiction isn't something he's equipped to address. Some call the result treat and street.
I often feel like it's a revolving door. I treat them for their urgent problem, send them out, knowing full well that I haven't really affected the underlying problem.
Measure 110 would establish addiction recovery centers and increase funding for treatment programs, overseen by an accountability council appointed by OHA, which Foster says is a good start.
Certainly, I feel frustrated that I have so little I can offer these patients.
That's only half of the equation. The measure also aims to decriminalize small quantities of drugs. That means if you get caught, you can simply pay a $100 fine, or you can go to an addiction recovery center for a health assessment. That health assessment is a substance disorder screening by a credentialed professional, but to be clear, it's not treatment. After that, case managers at the center can help connect them to resources and treatment, but only if that person chooses to seek them out.
I would have paid the fine and told myself that I could handle it on my own and that I'll quit tomorrow. The problem was, tomorrow never came.
Jim O'Rourke is a Portland criminal defense lawyer who is himself in long-term recovery. He opposes the measure and believes it would destroy existing pathways to treatment and replace them with an inadequate system.
The state of Oregon has plenty of assessment and referral resources already. We don't need any more of those. What we need are more residential treatment beds.
Many counties, such as Lane, already offer drug court programs. O'Rourke says that the trend among counties is to create diversion programs that connect addicts to treatment without any court proceedings at all.
That is the path of progress, and that path of progress will be interrupted by this measure. A lot of people lose the opportunity to be motivated to do something they can't do themselves because they're addicts.
Douglas County Sheriff John Hanlon fears that without the threat of punishment, access to drugs and the number of individuals with addictions would increase.
But what's going to be a deterrent? There's not going to be a deterrent. If there's no criminal penalty, there's no threat of or danger of the police come crashing through your door.
Right now, people continue to use despite the possibility of the penalties and the convictions. So why not try a new approach?
That was Brooke Reinhardt, Executive Director of the Public Defender Services of Lane County, who supports the measure.
Typically, a client of mine who gets in trouble with a drug-related crime, if they don't qualify for drug court or can't do other treatment-based solutions, they end up doing a little bit of jail up front, but then if they mess up probation, they're likely to do 60 days or more of jail later. And that's really destabilizing when we're talking about simply substance use.
He believes that in the end, Oregon's criminal justice system is simply overburdened, and small possession cases take too many resources. This measure also has a considerable financial impact. It would require $57 million annually using marijuana revenues, reducing funding between 2021 and 23 for the state school fund by $73 million, and mental health services by $36 million, among other funding reductions to state police, cities, and counties. It would be a radically new approach, the first of its kind in the nation, as the state struggles to save lives from the grip of addiction. In the newsroom, Chris Lewinberg, KEZI 9 News.